Chris, choking is the leading cause of injury and death among children, especially those aged 3 years or younger. Food, coins, and toys are the primary causes of choking for a child, according to Dr. Nguyen Pham of Children's Hospital of Orange County.
This is what makes pediatric, choking hazards so scary, is that brain damage can occur, if the airway is blocked off within about 3 to 4 minutes in a child, so you don't have that much time. So if that object doesn't dislodge itself immediately, one of the first things I would do is call 911 before you even start trying to get it out. And sure, if they come and your child's fine, that's a waste of effort for them. But you really don't have a lot of time to work with, when your child's choking. Well, if you're a parent of a small child, I highly recommend CPR training, because they go over the techniques. And essentially you want to do the Heimlich maneuver. But what's tricky about kids is there's different ways to do the Heimlich based on the size of the child. So for smaller children, you want to have them on your knee, where you thrust on their back and then their abdomen. And then for older children, you want to do the Heimlich just as you would with an adult. When I talk to parents about this topic, I like to divide it into two big groups. So I talk about foods, right, which are a big risk, and then the other thing is toys. As far as toys, the things that concern me the most are things that are small and very hard, and then spherical shaped toys, because clearly those can lodge and completely block the airway. There's one item in toys that is very under the radar, but actually is the most lethal toy that children die of when they choke, and that happens to be latex balloons. And what makes the latex so dangerous is that once it gets in their airway, it conforms to the airway, so it can seal off the airway completely. And then what's different from a solid object is if you do the Heimlich or CPR, you can't get it out. So there are two big categories I think of when I think of foods that are dangerous to kids. And the first is a food item all in its own category, and that's hot dogs. So if you were going to create something that would plug off an airway, you're an evil comic book villain. You couldn't do better than by creating a hot dog. It's the exact size of a pediatric airway. It's a long cylinder, it's rubbery, it's just like a cork. And when a child lodges that in the back of their throat, often it can fit so tightly that no matter what you do, you can't get it out. And so hot dogs are by far the highest cause of death for choking in children. The other category outside of hot dogs are small, hard foods or cylindrical foods that can block off the airway completely. So in those categories, you're talking about grapes, carrots, these cylinders that are hard, firm, and can completely block off the airway. And then the hard, small things are things like nuts. The thing I take out most commonly as far as food items, though, are peanuts. And what I most commonly see is that one lung is blocked off, one of the main stem bronchi, and the child has been breathing with one lung for, however many hours or days it's been since the choking incident happened. And this is probably the scariest case for any otolaryngologist, any ENT doctor. This is the highest anxiety case we get when we're on call, just because the margin of error is so little, right? Basically what we do is we sedate the kid, have them breathing on their own, and then extend their neck back in the operating room. And we have telescopes and little micro instruments with cameras at the end of them. And we pass it from their mouth all the way down into their lungs. And then begins this process of trying to wiggle this peanut or toy or whatever it is out of place. And the majority of the time we can get it out pretty easily. There have been cases that I've been where it's been an hour, 2 hours trying to do whatever you can to kind of wiggle this little object out of the lung.
Because it's impossible to prevent all choking episodes among children, everyone who cares for children should know how to administer the Heimlich maneuver. It can save your child's life. So let's keep our children safe. For the American Health Journal, I'm Laura Windsor.